Today's closing numbers after a volatile week of trading. U.S. stocks rallied in another day of gains. The Dow posting its best day of the year despite Russia's invasion of Ukraine. The Dow surged 2.51%, up 834 points. The S&P 500 rose 2.4%, and that was up 95 points. And the Nasdaq gained 1.64%, up 221 points. A consumer alert: if you have a Honda CR-V or a Honda Accord, there's been reports of unexpected braking. The National Highway Traffic Safety Administration is investigating CR-Vs from the year 27 to 2019 and the 2018 to 2019 Accords. The concern has to do with emergency brakes activating with the driver touching the brake pedal. Gas prices expected to reach $4 a gallon nationwide soon. Oil futures are now more than $100 per barrel. The spike comes largely from the Russian invasion of Ukraine and the consequences that have come since it started. President Joe Biden says he will do what he can to help Americans get relief at the gas pump. Bad news for fast food fans. Burger King's chicken nugget meal is being cut from 10 nuggets to 8. The fast food giant says this will help it cover some of the cost of inflation. Cutting down on nuggets, huh? The cost of the meal is staying the same, even though you are getting less nuggets. Some of Burger King's rivals have taken similar actions recently. The CDC is relaxing its COVID guidelines as many across the country begin to express frustration with the current protocols. Experts say the update may signal a shift from combating a pandemic to managing an endemic. Here with me now to discuss the guidelines is our friend, Dr. Sujan Gogu. As always, thank you for joining us, Doctor. Is this good news? Because based on what we know so far, about 70% of the U.S. population lives in areas considered to be low or medium risk, where people are advised they can go indoors without masks. Tell us your thoughts on these new guidelines and what we're seeing across the country.
Yeah, I think, obviously Omicron has really changed drastically. And I think this pandemic has changed a lot. I think it stems from, we've gotten a lot more people vaccinated. We've gotten a lot more people boosted. So a lot of people do have a level of protection. I also think you got a lot of people now that have some natural immunity, as well as several million people have been infected. But I think the big takeaway, I think, is we got a lot of new therapeutics that are available now. We have Paxlovid that anybody can get at a pharmacy that can prevent you from getting severe disease or being hospitalized. We have monoclonal antibody that's available. We have remdesivir, which is an antiviral that could be given as well, and we have other therapeutics that are available as well. And so we have more tools in our toolkit now to do something like this. But I still think it's very important to be cautious and know your level of risk as well in your community, but particularly yourself. If you're an individual that is immunocompromised or has chronic disease, you might need to wear that mask and be more careful of your surroundings.
Yeah, absolutely. And I mean, in the 2 years that we've been dealing with this pandemic, this is the first time the CDC has really come out and talked about this way of relaxing guidelines. They're not an enforcement agency, so they can't force people to do things. They can't force city and local governments to do things a certain way, but they have sort of left it more on at the local level for mayors to decide and city leaders to decide what's happening in their area. Dr. Gogu, do you like this approach that it comes down to more people in their communities, their local leaders having more of a say in what's happening based on the numbers in that area?
Absolutely, because most spread is usually community spread. And I think based on the new guidelines in terms of assessing low, medium, and high risk, that's predicated not only on the amount of transmissibility that there is in the community, but really, what is the hospitalization rate of COVID cases? What are the level of beds that are taken up due to this virus? Because there is strain, obviously, on the health system that exists there. So I think this is a better way to go about it, is really looking at it on a local level.
Is there anything else you would like to hear from the CDC? Do you think that they're giving enough information, enough guidance? Do you want to hear more from them down the road? Do you want to see adjustments? What are your thoughts on the CDC and the way they're handling this?
I think I think particularly, I think when I see a lot of criticism, obviously, of the CDC. I think when they rolled out initially their their guidelines when it comes to 10 days being out or versus being 5 days out. I think there could have been more clarity, in that when they relaxed those measures. It seemed like there was a lot of pressure that was being placed upon the business community, on the CDC on that. I think, even if you look at that right now, a lot of patients, even at day 5, if they take a rapid antigen test, they can still be positive. And I think there needed to be more firmness in those guidelines when they relaxed them then. I even think when you look at this measure, particularly, I think if you look at yesterday, you look at the entire country was on those maps of transmissibility were very high risk areas. And magically today, if you look at those maps, a lot of them are not red anymore. They're low to medium risk. And so I think, there needs to be much more explanation on some of these parameters, but I also think it's very important that people understand that science is not binary. It's not a yes or no answer. Science is evolving, it changes, guidelines change, this virus changes. And so I wouldn't be surprised if there's further changes down the road, whether there's more restrictions or less restrictions, just based on how this virus evolves.
All right, as always, we appreciate your expertise and time. Thank you so much, Dr. Sujan Gogu, for being with us here on BNC. Have a great weekend.